Hello, my name is Melvin Robelo, and I'm part of Group 3. And today we are going to talk about the healthcare system in Honduras. To start talking about the healthcare system, we need to talk about how was it before the pandemic starts. The healthcare is divided into sectors, the public and the private. The public one has two subsectors. They are the CESAL, the Health Secretary, and the IS, Honduran Institute of Social Security. And the private one has only 31 hospitals that some of them are non-profit. Um, and 18% of Honduran population do not have access to any health system. They cannot access to public system or to private one. Well, the CESAL have two levels that are divided in 20 regions of salubrity. 18 of them are departmental and two of them are metropolitan, that are 1,635 establishments. The hospitals in Honduras are very pure. Most of them were built last century and do not have a good equipment. To this is that many of them do not have enough doctors and nurses. Hospitals are usually looted or sacked like the is in 2014. We can continue saying that has two levels. The first level, we have 1,078 rural health centers, 436 health centers with doctor and dentist, 74 hospitals materno-infantil, 15 dental schools, and 3 emergency clinics. And in second level, we have 15 hospitals of type 1 that are named basic hospitals, 7 hospitals of type 2 that are named general hospitals, and 8 types of hospital 3 that are specialty hospitals. But we have only a type 4 of hospitals that is called institute, and that hospital is Hospital Escuela Universitario that is located in Tegucigalpa, Honduras.
As of Monday, March 16, the quarantine measures began where the partial confinement of the population begins, but the private company and the public sectors began to apply virtual work in educational centers at a levels to the virtual delivery of class. On March 26, the authorities of the Honduran Ministry of Health confirmed the first death from the coronavirus in Honduras, a 60-year-old man who was admitted to the Leonardo Martinez Hospital in San Pedro Sula. Little by little, the virus spread due to several factors apart from its high contagious power, precarious health service, lack of infrastructure, lack of medicine, and lack of doctors and nurses. The incorrect behavior of the population with respect to biosecurity measures, ignorance of the behavior of the virus, and the need of the population is to leave their homes to buy food. Given the speed with which the pandemic was spreading, government authorities such as COPECO, SINAHER, the Ministry of Public Health, and the Ministry of Security made the decision to impose a curfew from March 29 to November 8, 2020, as well as the regulation of the circulation of citizens from the supply of food and medicine.
Hi, my name is Franco Canales and I'm going to be talking about the first results that were obtained from the actions that the government took at the beginning of the pandemic. And as we know, The government set a quarantine on March 12th in order for people not to get infected by COVID 19. And they also set a curfew. That, if you don't know, a curfew is a regulation that requires people to stay indoors between some specific hours, typically at night. These were the two methods that the government implemented, and they affected many people because when people went out of their houses, they could only go to the bank in order to have some money or go to the supermarket in order to buy some food. These were like the two main places during the quarantine, because the beginning of the quarantine, because the other shops were closed due to the same quarantine and the curfew. But these two methods weren't well received by the hardworking people. And when I refer to hardworking people, I'm referring to the taxi drivers, to the building workers, because they have to go day by day in order to gain their money. So if they don't go out a day, they won't gain some money. So the quarantine affected them because they couldn't go out of their houses to work, and this led many families without food and without the essential things of a house. So the first results that were obtained from the action of the government were like bad results.
Hello everyone, my name is Josué Daniel Garcia Medina, and today we are going to talk about Ministry of Health's recommendations for COVID-18 emergency in Honduras. They recommend to foment the following biosecurity measures. Wash your hands with soap and water very often. Use hand sanitizer. When coughing or sneezing, cover your mouth and nose with your arm or use a disposable tissue. Don't greet with kiss or hug. Don't share food or drinks. Stay in home while quarantine. If you feel sick, use mask. Keep yourself in quarantine and ask for information to 911. If you present complications as breathing problems or chest pain, ask for medical help immediately. This was the first recommendation communicated by the Ministry of Health to the Honduran population when all started in the country on March 2020. These recommendations were general and hurried. The pre-established measures from World Health Organizations were taken as effectives in your country. They didn't think about the social and economic impact. It weren't studied before, nor after it was applied, and even now, we can see the consequences of the decisions. The mistake was not to take an action plan against the pandemic and the institutional weakness of our health system. Thanks.
Hi everyone, my name is Antonia Nariva, and now let's talk about the health situation in Honduras during the pandemic. In Honduras, the health system is composed of public sector and the private sector. The public sector is composed of by the Ministry of Health (CESAL), which provides services 60% of the population, and by the Honduran Institute of Security Social (ISS), responsible for collecting and administering tax resources from compulsory contribution of workers and employers. Ensures 12% of the population, and it is estimated that 18% of Hondurans do not have access health services. The private sector serves 10% of the population. In health emergencies, since 2019, we had influenza, then severe dengue causing deaths of children and adults, and in 2020, still with an epidemic. Honduras has been one of the countries hardest hit by these multiple epidemics, although no country in the world was ready for the pandemic. This was also due to the few investments of governments in health. Bilateral negotiations were not the same in all countries and the amount of money they had. Therefore, vaccination in the region is slow, and for the expert consulted is a fact that depends so much on health systems, as well as the governments that negotiated and the resources they allocated. The experts consult assured that although they would not have the best technology, they could contribute to meeting the basic needs of the population. Both agree that the priority for the countries of the region must now be to implement an efficient vaccination strategy and communication strategy and that reaches the population in a simple and effective way. It seems that the solution is not so simple because in the management of the health and the pandemics, specifically other factors such as government policies, government decisions, the attitude of citizens, lack of employment, and poverty also have an impact.
Hello, my name is Genesis Valladares and I am going to talk about the response to the hospital collapse in COVID-19. On February 10, 2020, Juan Orlando Hernandez approved the executive order ultimately declared national emergency due to COVID-19. There are some deficiencies there happening in 2020. Number one, hospitals were without space. There was not sufficient space for the people that to be assisted. Number two, medical personnel and healthcare workers have repeatedly pointed to the weakness of the healthcare system and the government's inability to respond effectively to the pandemic. Number three, a recent report from civil society organizations shows that out of the 10 Hondurans receiving medical attention in the public health center had to buy their own medicines. Number four, irregular purchase. Instead of buying medical reserve on improving the health care service, the President of the Republic divided the acquisition made by the Health Ministry into three parts. Number one, Copeco. Number two, Invest Age. And number three, Banco de Occidente. There was a purchase of 7 mobile hospitals and 7 facilities for the treatment of hospital waste by Invest Age. The equipment will arrive for Turkey until the end of May, but is now 2022 and they never arrive. And these are just a few of the deficiencies in medical care.
Hello everyone, my name is Karen Jolivet Portillo. Today I'm going to talk to you about the current state of the healthcare system. The pandemic in our country highlighted the weakness of the health system. Regardless of the fact that no country in the world was prepared for such a health catastrophe that is only comparable to the influenza pandemic of 1819, in our country the pandemic was faced with a series of shortcomings and inconsistencies in health policies. Some of the mistakes that have been made are the lack of leadership in the Ministry of Health, which generated opinions from different points of view and from different platforms of such a way that generated some confusion, especially at the beginning of the pandemic. The weakness in the detection and follow of cases contributed at the time of the more efficient and rapid spread of the virus among the Honduran people. No technical teams were formed to deal with the situation. The current panorama of this pandemic is progressively become an endemic process. That is, it's going to continue for many months, perhaps for some more years, and it's probable that coronaviruses that affect human beings will not disappear but will mutate and acquire different forms of infecting human beings as we more serious and fatal forms. We are progressively having more transmissible but less virulent variants. The health system must adjust and strengthen the vaccination campaign by focusing on population groups and school, college, university, factories, massage centers such as markets and supermarkets, in order that reach more people completed the vaccination, especially that are still incomplete, and strengthen the reconfirmance. Thank you for your attention.